A 71-year-old male was brought to the emergency department for a sudden onset of symptoms, including hypertension, loss of consciousness, sudden severe headache, sudden weakness, nausea, vomiting, and confusion. His lab values were pretty normal. His PT and INR were slightly elevated due to the fact that the patient was taking Coumadin. Blood glucose was slightly higher than normal, and his cholesterol levels were elevated. He was taken to CT, where they found that he had a diffuse subarachnoid hemorrhage in all basal cisterns, bilateral sylvian fissures, and interhemispheric fissures. This was caused by an aneurysm rupture in the middle cerebral artery. And here in this picture, you can see the hyperechoic areas. That's the blood filling the subarachnoid space. Here's a coronal view showing the same thing, that blood filling the subarachnoid space. So hemorrhagic cerebral vascular accidents, or hemorrhagic strokes, are caused by a weakened vessel that ruptures and bleeds into the surrounding brain. The leaking blood causes a buildup in pressure and swelling, compressing the brain and causing damage to the tissue. There are two different types of weakened vessels that cause hemorrhagic stroke: aneurysms and arteriovenous malformations. And there are two different types of hemorrhagic stroke: subarachnoid hemorrhage and intracerebral hemorrhage. About 13% of all strokes are hemorrhagic, and they account for roughly 40% of all stroke deaths. Intracerebral hemorrhage is the most common type of hemorrhagic stroke. It occurs when a weakened blood vessel bleeds into the tissue deep within the brain. The bleeding causes the brain cells to die and the affected area of the brain to lose its function. Symptoms include paralysis, numbness in any part of the body, inability to speak, inability to control eye movements correctly, vomiting, nausea, difficulty walking, irregular breathing, stupor, and coma. Risk factors include arterial hypertension, which is the most common cause, intermittent claudication, smoking, advanced age, heavy alcohol use, and use of cocaine and or amphetamines. So here's a picture of an intracerebral hemorrhage. You can see the smaller arteries diving deep into the tissue, the brain tissue. When these rupture, that's what causes an intracerebral hemorrhage. A subarachnoid hemorrhage occurs when a vessel on the surface of the brain ruptures and bleeds into the subarachnoid space, which is the space between the brain and the tissue covering the brain. As the blood fills the subarachnoid space, it mixes with the cerebral spinal fluid. This accumulation of blood and CSF increases the pressure surrounding the brain and damages it. So a test that can be done to see whether it's a subarachnoid hemorrhage or an intracerebral hemorrhage is a lumbar puncture, which can be used to test the CSF for the presence of blood. The most common cause of a subarachnoid hemorrhage is a ruptured cerebral aneurysm. An aneurysm is a dilatation of the artery that involves all three layers of the arterial wall, and other causes include AVM, arteriovenous malformation, bleeding disorders, blood thinners, and trauma. Symptoms include severe headache that starts suddenly, loss of consciousness, nausea, vomiting, inability to look at bright light, stiff neck, dizziness, confusion, and seizure. Risk factors are similar to those of intracerebral hemorrhage, and others include oral contraception, hormone replacement therapy, ethnicity, hypocholesterolemia, rigorous physical activity, lean BMI, and diabetes. So you can see here, this is a picture of a cerebral aneurysm and the rupture of the aneurysm, and that blood filling into the subarachnoid space. Transcranial Doppler sonography is a way to assess intracerebral hemodynamics and to evaluate for cerebral vascular disease. So it has many uses, but the one that we're looking at is the detection of degree of vasospasm following subarachnoid hemorrhage. So a 2 megahertz transducer is used, which allows penetration through an adult skull, and there are 3 different windows that can be used to view the major intracranial arteries: transtemporal, transorbital, and transoccipital. So this is a picture of the 3 windows. The transtemporal window is used to examine the anterior, middle, and posterior cerebral arteries. So the internal carotid artery divides into the middle cerebral artery and the anterior cerebral artery. So 3 to 4 days following a hemorrhagic stroke, focal or diffuse vasospasm of the MCA may occur. Vasospasm is the narrowing of the arteries by persistent contraction of the blood vessels. Vasospasm is most commonly visualized in the MCA, middle cerebral artery, and displayed when the peak systolic velocity is greater than 200 centimeters per second. So this patient had this exam performed 5 days following his subarachnoid hemorrhage, and it found that he had severe vasospasm in the proximal right middle cerebral artery with a peak systolic velocity of 303 centimeters per second. This CT was also done 5 days post-hemorrhage, and it shows partial absorption of the blood with decrease in attenuation coefficient and blood density. Hemorrhagic CVAs are fatal, and treatment options vary depending on the severity. Immediate treatment is critical to avoid death and disability. So treatment for hemorrhagic stroke has two main focuses: to control the bleeding and to alleviate the pressure. The first step to control the bleeding is to determine the cause of bleeding. Once this is determined, medications can be given to decrease the amount of bleeding. Also, endovascular coiling and clipping are surgical procedures that can be used to seal off aneurysms and to prevent more bleeding. Antihypertensive medications are given to decrease hypertension, and also a ventriculostomy can also be performed where a small hole is drilled into the skull to decrease intracranial pressure. Recovery and prognosis, like I said, are variable and dependent on the severity of the hemorrhage and how long before treatment is given. About 30 to 60% of patients with hemorrhagic stroke die. So this patient was given medications to reverse the effects of his blood thinners and also to decrease his blood pressure. And then 48 hours post-hemorrhage, he was taken to surgery for an endovascular coiling procedure. To prevent hemorrhagic cerebral vascular accidents, it's important to maintain a healthy blood pressure, exercise, avoid tobacco products, alcohol abuse, and illegal drug use, staying within a healthy weight, adjusting your diet, and making heart-healthy eating choices, managing your stress properly, and having a steady sleep pattern. And those are my references.